awesome was that? My name is Janelle Ryan. I'm the marketing manager for Beyond Basics Physical Therapy. I want to thank everyone for joining us tonight. We're going to have a quick panel discussion. If I could have my panelists up here. First and foremost, the creator of Lady Parts, Bonnie Gross. If I could have also the founder of Beyond Basics Physical Therapy, Dr. Amy Stein. The inspiration behind Dr. Silverstein, Dr. Goldstein. An incredible OBGYN, Dr. Creatura. And last but not least, our favorite mental health specialist, Kelsey Bates. So I'm going to help her out here. You're carrying a weight. Awesome. I have my little script here. So, first and foremost, if you were one of the first 50 people, you should have received a friendship bracelet. Hold on to that because at the end we're going to be doing a raffle, 2 of which will be a complimentary physical therapy session. We also have a Wellness by Nature CBD package and a package of books, Heal Pelvic Pain and Beating Endo. So, as you got to witness just now, through humor, honesty, and vulnerability, Lady Parts sheds light on vulvovaginal and pelvic health in a way that is rarely seen or openly discussed. At its core, this film is more than just a physical healing. It's learning to advocate for yourself, breaking through stigma, and finally feeling seen in an experience that so many people go through in silence. So first, Bonnie. It is extremely vulnerable and hard to put a story like this out there. I especially enjoyed how Paige's parents interacted, responded, and supported her. Plus, the quick wit and comedic presentation of such a topic was brilliant. What was the reasoning behind making this story into a feature film?
Thank you. Great, nice working. For me, if you don't know, I got a vestibulectomy in 2016. Dr. Goldstein performed it, who's on the stage. And I met Dr. Goldstein through Dr. Amy Stein. We're actually related, we're cousins, which is kind of crazy. But in 2016, when I ended up getting that surgery, I had seen years and years of doctors who just had gaslit me. I didn't know really where to turn for help. And I was told everything you heard in the movie. At 19 years old, I was told to drink wine for painful sex. They tried to put me on Xanax at one point. They told me I was just a little crazy. And finally I found there, and it was the first time I was believed and taken seriously. And fast forward to recovery, it was the most isolating experience in the world because no one talks openly about vulvovaginal or pelvic pain at all. And that was like 2016. So I mean, this is like before TikTok, before, Instagram is just like pictures at that point. Like there was no reels or anything like that. So there was really nothing out there about this. And so when I did actually write a blog post in 2016 about it, and at the time it didn't really say much, but it had some stuff in there, and it got like 600 views. I had people reaching out to me that I hadn't heard from in years, being like, wow, I had no idea you were going through this, or I know somebody going through this, or I know something similar, who did you see? I have nowhere to turn. And it just kind of became apparent to me that, oh wait, maybe this isn't just happening to me. Maybe this is really common, and it turns out it is very extremely common. And from that point on, I was, I didn't go to medical school, so I was like, I'm gonna do what I know how to do, which is make a feature film. And it started as a TV pilot. I bought a one-way ticket to Los Angeles with no job and no place to live, and slept on an air mattress for 3 years, and went back to school for screenwriting at UCLA, and then decided that I wanted to do this. And in 2020, when furlough happened and the whole world shut down, we did a table read, and I finally just hit the point where I was like, I'm tired of waiting around for this film to get made, so I self-financed the entire film, and we had an amazing cast and crew who came on and were like just willing to jump in and be a part of this crazy project, and we're really passionate about it too. And it was always a comedy, even from the TV pilot stage, because a comedy is how we relate to people and how we, you know, a subject like this, sometimes it's so hard for somebody to kind of talk about it, but comedy is a nice way to dip a toe in the water. And I'm sorry, I have allergies, that's why my voice sounds so weird right now. But I always say, you know, we see a lot of documentaries and stuff about that, like this topic, or, you know, I'm sure you've seen like Below the Belt or The Pink Pill, and those things are amazing too. I don't want to discredit any of that. But a lot of times when you're getting like facts kind of spewed at you, it kind of is hard and it may not stick. But what I really wanted to do that was so different is make it into a narrative feature where you could have a character that you could say, oh my God, I relate to her. I know someone like her, and it really humanizes it and makes you kind of see the comedy in all of it, that, you know, even if you don't have vulvovaginal pain, you've probably been dismissed by a doctor, you've probably moved home with your parents at one point, or had an awkward conversation. And so that was the hope with this film, was to just humanize it.
I love that. So as many of us know, Lady Parts has been on the road for the last couple of weeks. And I wanted to quickly ask you, what has been your most favorite part of taking Lady Parts on the road?
Good question. That's the first time someone's asking that one. If you don't know, this is our 7th city in the past 2 months, so it's been a little crazy. I think one of my favorite moments we had, hard one, was probably Boston. We were at Somerville Theater and we sold out. I know. And and what was the best part is we were originally supposed to be in their like smaller theater, and then when I got there, they're like, oh, just kidding, we put Project Hail Mary there, and you're gonna be in the bigger theater. And I was like, take that, Ryan Gosling. But that just felt like a personal win.
I love that, because
Yeah.
I'm actually from Somerville, we talked about that.
Yes, and that theater's amazing. You should go if you are ever in Somerville, it's amazing.
Yay. So let's switch gears from filmmaking to the incredible panel of medical experts that we have up here. So first and foremost, Dr. Creatura, it seems like Paige really struggled to find a diagnosis even after seeing multiple providers. As an OBGYN in this field, what do you wish all medical professionals understood about vulvovaginal and pelvic pain?
Well, I think the whole culture has to understand that we minimize feminine suffering, right? So that sounds pretty heavy. But I would say that from my standpoint, that professionals within my field understand that we are taught to do and take care of patients in a very particular way, and it's not actually very patient-centered, right? We're taught to extirpate things, we're taught to get through the day, make sure that we can like figure out how to write something down, but we're not always listening to the patient. So I think that when we have a situation like, and not just this particular situation, but any situation where there's suffering and we don't know how to relieve it, that we somehow project this idea that the patient's crazy, that she is fine, that she's making up something that we haven't been able to solve. It's sort of like ego dystonic to us that we can't solve it, and that's why you got a lot of the kind of gaslighting that you experience. And I think that, to be fair, most of us in OBGYN want to do well by our patients, but we're not trained to actually address the suffering that they present to us, that we don't really learn properly about anatomy, physiology, we don't learn about pain medicine, and certainly I never had any of that training when I was training so many decades ago, but I knew that culturally, since we are so accustomed to just putting up with female suffering in so many levels, that it just was never a priority in our training.
How do you think that can be changed, training-wise?
I
I know many people on this panel are trying to work to make that happen.
There's a huge amount of shift in obstetrics and gynecology and medicine in general, because I think when you have people in medicine who actually can suffer from these problems, that we see them differently. So I think that there's always been a patriarchal culture that sees women as being that accepts that we would be suffering and that we would be complaining, and even mistrusts us as narrators of what we're actually experiencing. And I think as we have more and more women running OBGYN departments and more females allowed to do science, that the science that we do changes because the questions that we ask change. We ask questions differently, we perform science differently, and we practice medicine differently. And that's not to say that there aren't a lot of amazing men in OBGYN and that there are a lot of crummy women who've been trained poorly, but I think that in general, that as a culture, we lack the kind of sexuality education and honesty in medicine that we need to really address these pretty complex problems. You know, what you have been through is not a simple problem, even though there is a solution. It's not an easy one.
Thank you, Dr. Creatura. As we mentioned, this is based on Bonnie's true story, and of course, Dr. Silverstein is a nod to you, Dr. Goldstein, minus the ponytail, of course. Since we know films are fictionalized to a certain degree, oh, this was not planned.
I had no idea this was going to happen.
See,
I should have gotten a medical room once.
pelvic pain can be fun. Since we know films are fictionalized to a certain degree, can you give us some insight into what happens when a patient comes to you for a consultation and ways you're able to make an appointment more tolerable, especially when it comes to patients experiencing pelvic pain?
Well, first you cross-dress. Well, first of all, before I say anything, it's such an amazing thing and a weird thing to see yourself on screen, and it's really interesting to see the other side of things. You don't really know how you're perceived, and I think it was a very kind portrayal. You know, so thank you very much for that, for the kind portrayal. I sort of forgot the question. I got so.
What is it like when someone comes to you for a consultation?
Fair. So the first thing is that we do take our time. Patients, before they even come to us, they've filled out about a 200 question questionnaire, which can take about 2 hours. I think that's actually really important because it allows the patient to understand that they're going to be taken very seriously. And then we review that entire 200 question questionnaire before they show up. And I think that that's really important. So, you know, we say that we've done this and we've paid attention to them and we believe them. And no gaslighting in our, we actually wrote a paper that was published this year in JAMA on gaslighting, and we did a study of how many women have been gaslit about these things. So the first thing is to let women know they're going to be believed and they're going to be taken seriously, and we take the time to do that. As far as then the second thing is an exam, and I think the exam is petrifying, especially a person who has had a lot of pain. So, you know, we tell patients they're in charge. I always say that I'm a world-class red light, green light player, and that like a Olympic quality red light, green light player. And I say that any point in time you say stop, you stop immediately. And we let them know that they're in charge and that it can take, and the time is of no issue. We don't take insurance. I will never take insurance, sorry. But
there's a reason for that.
But the reason for that is simply that it takes about an hour and a half to 2 hours for an evaluation. And today we had a patient took 2.5 hours for that evaluation. And we never rush people. It's hard. This is really hard. And then we sit and we make sure that we tell them, figure out why they're having pain. It's a very algorithmic approach. And which is published and given out freely to the world as much as possible. And we figure out the cause of the pain. There are many causes of the pain. And only about 7% of the patients who we ever see are even the word the vestibulectomy or surgery is ever discussed. So the majority of time, 60% conversely have pelvic floor dysfunction, will get an easier treatment. As important, but a little easier. So I guess that's a long answer to this, but women's pain needs to be believed and it needs to be relieved, and I think that that's pretty much our motto.
We need that on a t-shirt. What's new in vulvodynia research, Dr. Goldstein?
I come with props. besides my weight. So, I don't think that's it. That's not my prop. That's my prop. Okay.
Oh.
I know. Oh, I know.
Not what I was expecting.
What's in the box?
This is right, the new dilator set cactuses. Okay, now, okay. This is the solution.
Okay, so this is the solution. So, about 3 years ago, I was very frustrated that although we've learned lots and lots about,
It is a bit distracting.
I was very frustrated that we've learned tons and tons about what causes vulvodynia, but we really hadn't moved the needle as to different treatments for vulvodynia. So I had an idea that I pitched to Lipped. I pitched to the International Society for the Study of Women's Sexual Health, the National Vulvodynia Society, and I have a foundation myself. And so the idea was we were going to bring about 15 or 20 people together in a room, and these are going to be the world's experts, and they all had to pitch an idea as to what's a new potential treatment for vulvodynia. And we sort of treated it like Shark Tank. Basically, the world's really best vulvodynia people all got one idea, and they had to pitch it to the rest of us, and then we would throw critical acid on these ideas, and at the end of the day, we would vote. We would vote anonymously, and we'd vote anonymously, and we would publish it and say, how can we move the needle? So really kindly, again, Ishwish, Lipped, the MBA, my foundation, we all had this meeting, and the National Institutes of Health came as well. And we pitched these ideas and then voted. And so what I can say and publish, it gets published in the Journal of Obstetrics and Gynecology recently, so it's the #1 OB/GYN journal in the world, so that's very lucky. And the great news is that the top 3 things that were voted on are being funded and being studied. The first one is a study of a medication called ketotofin. It's a mast cell stabilizer. A lot of these medications, a lot of the causes of vulvodynia are mediated by inflammatory white blood cells called mast cells. And so we're having a randomized controlled trial sponsored by the National Vulvodynia Association and my foundation. And so that was ranked #1. And so that anyone, all the stuff is on our website, vulvodynia.com, look under research and you can read about it. But I'm holding a cactus here. Why am I holding a cactus? The reason I'm holding a cactus is this is a very special cactus. This is a Racinifera cactus. And Racinifera is a cactus from Morocco that has a very special chemical in it. This chemical binds to nerve endings, and specifically pain nerve endings, only the pain nerve endings. And it's so strong, this chemical, that within 15 minutes, all the pain nerve endings are completely destroyed. But at the same time, normal pleasure nerve endings, the rest of the tissue is completely intact and not harmed. So the goal of this is that, and this is going to be a phase 1 NIH-funded study. It just went through to the FDA. It's going to go back to the NIH. But by the end of the year, what's going to happen is that people are going to go to sleep. And they're going to be injected with this compound with people who have neuroproliferative vestibulodynia, what they call vulvar vestibulitis in the movie. And they're going to go to sleep. They're gonna wake up 30 minutes later, and the goal is all the pain nerve endings are gone. There's no surgery. There's no 6 weeks of recovery. There's no year of recovery. It's you wake up 30 minutes later and the pain nerve endings are gone.
That is amazing.
So that's the goal. The goal is for me to be completely obsolete. I never have to do another vestibulectomy ever again. And you know, obviously it works, but it also is obviously torture, and costly, and a million other things to deal with it. But the answer is in this cactus. So let's hope it works.
Thank you, Dr. Goldstein. So we get a bit of a glimpse into the world of pelvic floor PT as Paige is doing her dilators. Amy, as a pelvic floor PT, could you tell us some more reasons other than just like surgery or like pelvic floor dysfunction and vulvodynia like we see in the film that might benefit from pelvic floor PT? Like what other types of things?
Other types of things. So conditions like endometriosis, irritable bowel. We actually do treat men with pelvic floor dysfunction. They do have pelvic floors. Dr. Oz doesn't believe that, but yes, they do. And
Everybody has a pelvic floor.
yes, everyone has a pelvic floor. We see bladder issues as well. We see tailbone pain, rectal pain, back issues. So a ton of things, and there's a lot that we can do as physical therapists. Our goals are to bring down the pain, so turn the dial down through manual therapy, mindfulness practices, breathing techniques, in through the nose, out through the mouth. And we have a lot of different things up our sleeve that we can help patients with.
What are your thoughts on pelvic floor PT, not just post-op, but prehab as well?
So the same idea that we need to, before surgery, we want to turn the dial down. We want to get rid of any issues that may surface that could be treated through pelvic floor physical therapy, and again, the mindfulness practices, and that's where Kelsey comes in as well. But really getting rid of any restrictions, any tightness, any misalignment of the sacroiliac joint, all of your hips. So making sure that everything's as optimal so that surgery outcomes are more optimal. And then post-tab is same idea. Continuing with the same techniques and treatment.
Thank you. Kelsey, living with pelvic pain can affect many areas of life, as we see in the film, including mental health, relationships, work, and everyday activities. How can patients navigate the emotional impact of chronic pelvic pain and learn to advocate for themselves?
I always like to share when I'm doing a phone consult or meeting anyone for the first time that I believe the pain is real. And I think sometimes the doctors that you're describing there are not qualified to be treating these complex chronic pain conditions, will gaslight and make you feel as if you are crazy. So mental health is one component. If you are in pain, of course you're going to be more depressed. Of course you're going to be more anxious. There's nothing wrong with you for feeling those things. Oh.
That was like an angel
Coming from the sky. And so I want to normalize that I'm a part of the team. Mental health is just one part of the team. I cannot rehab you or get you ready for it. I can't do the surgery. I cannot be your go-to physician. But this is one aspect of care. So I use a third wave model, and so all that means is we incorporate not only the reframing that comes from things like cognitive behavior therapy and dialectical behavior therapy, but we incorporate the mindfulness and the groundedness. And similar to what Amy was saying, this is a part of helping your nervous system downregulate. When you're in pain, you're in that fight or flight overdrive. So we have to give you tools to help you, normalize and understand, okay, this is what's happening in my brain when I'm in pain. and I'm not crazy, and how do I down-regulate? And there are distress tolerance tools. I'm not gonna cure your pain. I don't believe that's, in my philosophy, dealing with chronic illness, this is not something that I can fix alone. So I also like to emphasize that.
How do you even begin to process the weight of carrying what is often perceived to be an invisible disease?
Well, I'll use my prop here that I didn't know I would have. With a broken bone, you can see you need extra help or something is wrong. And because this is invisible, there's such shame and stigma and isolation and loneliness. So, films like this are incredible at giving people a space to gather, to meet people in real life, to have that community. Tight-Lipped is an amazing organization that offers community and gatherings in real life. So I think finding these communities that, thank goodness there are these communities now, gathering, being able to have other people understand your story is really helpful.
Thank you.
I just want to give a little plug for Tight-Lipped because they're also supporting all of this work, and one of the things that the organization is doing is making up for this gap that we have, that we don't always work in an interdisciplinary fashion. And all of us who work in sexual medicine with sexual problems for our patients understand that we're only going to get them better if we work together. So it's really a transdisciplinary process of addressing behavior, working on the mind, working on the hormones, working on the pelvis, working on the physical therapy that we need, and also getting patient advocates to come and train our learners so that they hear from patients and learn better about how to listen to their problems, how to see them as human people whose narratives they can actually endorse instead of question. And I think that's one of the main purposes of Tight-Lipped and the work that they're doing, and all of us have benefited from their advocacy, and I think that our future trainees will also benefit. So, sorry, I grabbed the microphone.
I love that.
Real quick about Tight-Lipped, I'm also part of, the New York chapter. We actually have a couple of New York chapter members here today, so if you go outside, you'll see a lot of paperwork there. If you want to join, there's actually a sign-up sheet, so if you want to write your name, email, we're always looking for more people to join, and we'd be really grateful to have you. And that's it. They did the whole plug for me, so it's a great organization.
We have time for maybe like 3 audience questions. We got started a little bit late. So I see a couple of hands in the back. Our helpful, handy volunteer from Tight-Lipped.
Thank you so much. Thank you so much for this movie. It was fantastic. I do have a kind of I had a question for the doctor in the beautiful purple top.
Dr. Creatura.
When you mentioned gap, there's a gap. What would you label the gap? And a question for the director, she can answer later. What's her hopes for the movie? Is it to be Oscar nominated?
Hell yeah.
I would say there's a gender gap of everything, but it's wider in medicine than it is in many other areas. Is that what you mean about the gap?
Would you say the opposite of would you say it's the opposite of a pleasure gap? So there's a pain gap, or like what's the gap?
Many people talk about an orgasm gap, which is usually associated with pleasure. So when we talk in sexual medicine about the difference between what a lot of straight women will experience versus straight men, we talk about an orgasm gap. But I would say there's a gap in just about everything that we experience as women. I don't know if I'm answering your question or not. It sounds like I'm not from your face.
Yes.
I guess I can talk from just again, I'm not a medical professional. I want to make that very clear. I'm just a patient advocate and a filmmaker. But a lot of what we do with Tight-Lipped is when we're going in specifically to OBGYN residency programs, because they aren't getting, there's zero right now in the curriculum that tells them, nothing in the curriculum right now says anything about vulvodynia, vulvar pain, any of the conditions that you saw portrayed in a lot of conditions that the people on stage treat, like in sclerosis, vulvodynia. I think endometriosis was just added, and it's not even concrete, from my understanding.
Not comprehensive.
Yes, thank you. But also, I'm not the director of the film. That's Nancy Boyd, who lives in Los Angeles, but shout out. But I'm the writer, executive producer based on my own true life. And I'm trying to remember you said where's it going? Oh yeah, so unfortunately we cannot be nominated for an Oscar. We do not qualify. It's a very hard process where you have to like screen in a bunch of theaters and do a whole thing and hire somebody to be an Oscars person. And we are way past that deadline. Yeah, I know, it's intense. And but all that to say, I think this is my first feature film, and what really started, I mean, this took me 10 years to make, from start to finish, and probably to where I'm at right now. And I never in a million years would have thought that a film about a vestibulectomy, or even something about vulvodynia in general, would ever be like something in the zeitgeist, or something that like we would see on a screen and be able to talk about. And so my goal for the film has always been to get it out to the people who need it most and make it accessible. So I wanted to put it on platforms and stuff where like anybody could watch it, and I'm really happy to say we are on Amazon Prime, we're on Google Play, and we're on YouTube Movies. So, and basically, you know, this all started grassroots. This was all about like me just wanting to like meet one other person who maybe was going through this at the time. And it's just, with everything we did, like when we first made the film, you know, I was like, God, we'll just be so lucky to get into a festival, you know, 14 festivals later. God, we'll be so lucky just to show this somewhere. God, we'll be so lucky just to like get it on a platform. And so like every win feels like such a huge win, especially knowing there's no other movie like this right now. My hope is that, you know, Netflix starts calling me and is like, yeah, we want to make more content about this. But I think it's needed. I think we need more stories. And I mean, a point I always try to make too is that like the story you're seeing up here, although it's my story, it's a privileged white woman navigating the healthcare system. And, you know, I am very lucky. I have very supportive parents who are here right now. Shout out to Andrew and Andrew. But I had very supportive parents. I had the financial means. I was able to have everything that, you know, and going in as a white person, I already know I have so many advantages for me. And so this story you're seeing is my story, and you're seeing how hard it was for someone like me to get care. So you can imagine how many stories are out there, because no one's story is going to be the same. And so I guess my dream is that someone sees this and goes, oh my God, we should make more content about this, which leads to people being like, wait, we should put more research into this, wait, we should talk about this, wait, we should change education, and maybe we topple the whole system.
Amen to that. 2 more questions.
I'm quite loud without a microphone, so tell me if I'm ridiculously loud. I'm Susan, I'm a friend of Amy's, so Amy kind of told me what to expect tonight, but I have to tell you, I've never peed so quickly in my life because I actually didn't want to miss like a second of the film. And I always have to pee. That being said, I wanted to say this was amazing because I don't know about all of you, but I was a huge fan of Sex and the City because it was the first show where women were really open about sex. But then I was very disappointed by, you know, the reboot, which I'm drawing a blank, where they just came back and they were older, and it just like that. Just like that, I was not impressed because I felt like it was a lot of focus on, you know, being older, and we all look older and feel older, but there wasn't a lot of focus on sex anymore. And there's all these jokes about, you know, Sex and the City cast as the Golden Girls, and it leaps them forward to their, you know, 70s and 80s, and I'm just like, what about this section where we're not in our 30s anymore, we're not done having sex, and we don't want to be dismissed, and where's the series about that, where it's showing experiences like yours in detail? So I hope to see something like this in a series that brings the same enthusiasm. But that brings me to my question for, I guess, 2 of the doctors, which is, what do you recommend for people when they are not happy with their OBGYN and they don't want to pay the price of a private practice cost? How can you interview a practice in advance to find out if they're up to date or if they're following the old standard, or is it just, it's private practice if you want that kind of attention, or are there questions you can say, like, I guess to just check before you launch into another practice where you're disappointed.
Let me give a plug for Ishwish. That's helpful, I think. You know, you want to make sure you have somebody with the
And
right
what does ISHWA
expertise.
stand for? 'Cause I'm not really
Ishwish
know.
is the International Society for the Study of Female Sexual Health, I think. Women's sexual health, thank you, women. It's important to know that everything not male has been siloed into obstetrics and gynecology, and that's an unfair burden for all of us, right? To think that everything in medicine that is not happening to men is our business, and that means that we can't be the experts that we want to be in every single area that affects female humans. And that's one of the reasons that there's such a big gap in our education. Because Dr. Goldstein has a very specific expertise, even though he's trained generally in obstetrics and gynecology. I have as well, but I specialize in certain things now that I do mostly. We also have a lot of medicine because we've been taking care of women for decades. But what you need to do is to figure out who's got the expertise that you need and who's going to be receptive to you. So sometimes as a patient, you do have the obligation to get educated about yourself, about your problem, through general media issues, media like good podcasts, good movies, good films, good books.
ChatGPT.
Sometimes, not always, but you know, you need to sort of like feel out what your issue is, get educated. You can present that to your healthcare provider. You can interview your healthcare provider. If that person doesn't know how to find what you need, then you need to move on. So I mentioned Ishwish because they do have a referral base. There are other organizations like the International Pelvic Pain Society, the National Vulvovaginal Society. They don't all have a patient portal, but it is a really good way to learn about what your problem is so that you can advocate for yourself and find the person who's trained appropriately.
Thank you.
I think, well, it's hard. First of all, at the end of the day, it is quite difficult. There are very few physicians who really know a lot about this, and then even fewer of them who participate with insurance. There are some of them in academic institutions. And again, Ishwish is a good way to try to find these people. But there are cost realities associated with this. Again, this is not something that can be done in 10 minutes or 15 minutes or even 20 minutes. And the reality of insurance-based medicine is volume, volume, volume. I don't disagree with insurance-based models. My wife is a doctor. If she takes insurance, she gladly takes insurance, but she also sees aged patients in and out. And we roughly make the same amount of money. Okay, but it's a different approach. And so it's really hard. If you need long-term specialized care, then you may have to go outside of the insurance model. That said, you may only see that person once or twice or 3 times instead of seeing 16 doctors and not getting the care and the expertise that you want. It's almost an even-sum game to try to figure this all out. So it is frustrating. There are people who do accept insurance who are good, but there aren't many. We're trying, Lipped is trying to train, again, the future of OB/GYN. As one of the people who has gone out and given out lectures to OB/GYN residents at 4 different very well-regarded academic institutions in this area, I will tell you that unfortunately, 30 years later, after I finished my training, the needle has moved this far. Now we're trying to do the best to move that needle further, but the baseline walking into that lecture before they have heard that lecture is not much better than what I had a training in 20,000 hours of residency training. I had one 45-minute lecture on sex in that 20,000 hours, and again, most of it was wrong. Not all of it was wrong. So now things are a little better, but they're certainly nowhere near where they need to be. And again, thanks to that, we're trying to again move that needle, but it's not, even that's not going to be enough unless the powers that be, you know, in residency education agree with it, and it takes lots of. It's not just putting in a book saying you're supposed to learn about this. They have to have clinics that are devoted to sexual pain, pelvic pain, sexual medicine, where they learn. Not just 1 hour, 2 hour long didactic is not going to move the needle enough. So I don't know. I don't want to make everything bleak. I think what they're doing is very important, but it's really just opening up the door. It's not going to be enough.
We have unfortunately run out of time, but as we're cleaning up, our providers will be available to chat a little bit, and we'll also be sending a follow-up email with more information about each provider, but we would like to have time to do the raffle. I don't know if you know exactly which I have it written down.
Oh my God, thank God, because I was about to say it's on my phone, which is recording.
So first we'll do the raffle for a copy of Heal Pelvic Pain and Beating Endo.
So, does someone have the bracelet that says erogenous zone? Congratulations!
Next we'll do the Wellness by Nature CBD package.
Okay, who has Sparkly Cave? Woo!
And then lastly, we are raffling off 2 pelvic floor physical therapy sessions. So my business card is inside of here with my email address. To schedule, just send me an email and I'll get you set up.
Okay, and thanks Janelle for setting all of this up, and Amy and everyone at Beyond Basics and Tight Lipped for volunteering and being here, our panelists who took time to come here. Thank you for coming on again on a Wednesday night. And it's going to be the same bracelet for both. So who has Read My Lips? Yay!
Oh my gosh, I know you. Hi.
I can do a different bracelet. I can think of something.
That's so kind of you.
Fine.
Yeah, who else?
Okay, I know a lot of the bracelets, so I'm going to think of one. Does anyone have Tunnel of Love? No. Lady Bits. Penis Flytrap. There we go!
You are hilarious, Brian.
Thank you, I'm here all night. But again, Tight Lipped is outside. They have a sign-up sheet if you'd like to join or learn more. And we'll be here for a little bit if you have some questions. And please stream the movie. Please leave us a review. It really helps us. We really appreciate it.